Welcome everyone to our webinar entitled COVID-19 Deaths, a Look at US Data. I am Tasha Overpeck, the event planner at the Advanced Academic Programs within the School of Krieger Arts and Sciences at Johns Hopkins University. And today I will be moderating a webinar with our very own Genevieve Briand. Genevieve Briand is the Assistant Director for the MS and Applied Economics program. She has taught for the Applied Economics program since summer 2015 and currently teaches microeconomic theory, statistics, and econometrics. She has many years of experience teaching numerous and varied economic and statistic courses. Her fields of interest are microeconomics and econometrics. Previously, she was an instructor at the University of Idaho, adjunct assistant professor of economics at Washington State University, and a tenured associate professor at Eastern Washington University. She received her PhD from Washington State University. And with that, I'll go ahead and give it over to you. Thank you.
Thank you, Tasha. So today is November 11th, so I'd like to start by thanking all servicemen and women, veterans, and their family. So please call me Genevieve. Today we'll be looking at very simple statistics and assess the effect of COVID-19 on US death using data from the Centers for Disease Control and Prevention, or CDC. And before we look at any data set, I will show you where I have found it on the CDC website, so you'll be able to go back to it later if you'd like. So this is a work in progress. I just wanted to get the conversation started, going rather. So what we're going to do is, as I go through the presentation, Tasha will help me with survey question, poll questions. And then throughout the presentation, I might invite you to think about a result we will be looking at, graphs will be looking at, and that, so I'd like you to do that so you can keep being engaged in the conversation. And then we'll take a Q&A, we'll do Q&A at the end of the presentation. All right. So specifically, today we'll be looking at data on weekly death, so all death per age group, and data on weekly death per cause of death. So why are we not just looking at COVID death? Because we cannot possibly assess the effect or the toll of COVID on death in the United States by looking only at COVID-19 death. So another way to say this would be, we are all familiar with US COVID-19 death numbers, but not necessarily with US all death numbers. And how can we say COVID death numbers are concerning if we don't compare them to total death numbers, the numbers that we should expect every year? So we are starting with the, our first poll. I think we are all familiar with COVID-19 death numbers, so we want to check on that. So if you could participate in this poll, thank you, Tasha. So what do you think specifically here? We'll be looking at numbers from mid-March to September 19th. What do you think the numbers are? How many COVID-19 deaths have we experienced in that time period, which is over 6 months? So 1,500 to 2,500, 15,000 to 25,000, 150,000 to 250,000, or 1.5 to 2.5 million. I see people are answering. Thank you. 78% of the attendees have answered the question. 80%. So the overall, does everybody see the answer to the poll, Tasha?
Yes, they can.
Okay. So thank you. So everybody, so the majority of people have chosen 150,000 to 250,000, which is the correct choice. According to the CDC, we had experienced 198, 385 COVID-19 deaths during that time period. Thank you very much for participating. So now we're looking at the total death number. So in the previous question, although the majority of you guessed that we had between 150 to 250,000 COVID-19 deaths, we still had 7% who thought we had 1.5 to 2.5 million, and 14% who thought we had 15 to 25,000. Now, for this one, thanks for your participation again. Since we gave, okay, so we have 58%, 65% of people voting. There, nobody chose the first group, which is reassuring. Okay, so the majority of people again guessed the correct number. I am surprised that still 24% of those who answered the survey chose 150,000 to 250,000, since we just, which is interesting, since we just pointed out that those were the numbers for COVID-19 deaths. So it's important to note that COVID-19 death numbers represent only a fraction of US death number. And the result of that survey show that it is very important to point that out. So we had, over that same time period, we had 1.7 million deaths. So we have 1.7 million deaths, total death, and 200,000 COVID-19 deaths, which means we had 1.5 million other deaths. So deaths due to other causes. I think it's important to put those COVID-19 number into perspective. I don't believe we've done that very much, so that's what we are doing here today. So it's important for the family of the 1.5 million, for the family and friends of the 1.5 million individuals who passed away over that time period. By concentrating on only COVID-19, we seem to have forgotten about everybody else, all the other individuals who passed away. And every individual is unique. Every individual has something to offer, and every individual's life is important. So thanks for your participation in those polls. Now we're going to go to our next slide and look at those data that we set out to look at. So to get there, we go to the CDC website, so cdc.gov, everybody knows it. And then we go to learn more about COVID-19. On the next page, we select the cases and data tab. And there on the menu item list, we select COVID View Weekly. So that's a link that takes us to this page. On this page, we scroll down all the way down to that page to the link provisional death counts for COVID-19. I know we just said we don't want to look only at COVID-19 death number, but that's actually where we are going to find all death counts per age group as well. So the next page, we select weekly updates by select demographic and geographic characteristics. And on that page, we scroll down all the way to this table. And I believe this table we are all familiar with as well. So with a peak of COVID-19 death numbers from week ending April 11th to week ending April 25th. So the count of deaths due to COVID-19 went up, and now they're going down. This specific table, this website was consulted on October 15th. So if you go to this page right now, it might look slightly different. So this is actually the first page of these tables. You see at the bottom where I circled in pink, it says 1 of 3, so first page of 3. So we're going to go to the second page to find the data that we are looking for. And so on the second page, you can see at the bottom there in pink, 2 of 3. So we are at the second page. What I've done is just select each row of that table and then copied and pasted it in my spreadsheet. So you can easily do that too, to check on what we're doing today. And you can choose a spreadsheet, a different spreadsheet than the one I'm using. Okay. So once I've downloaded those data, and then I made this graph. So I used Excel, but you can use another software. This is a 100% stacked column graph using the data we just downloaded and actually where we found the data. So what does this graph tell us? So it shows the percentages that each age group contribute to the total death numbers weekly. So each column, each bar over here represent a week worth of death. And so then so it's 100% death, right, for each bar. And then the upper section of it is light blue. That's the percentage out of the total from COVID-19 death of 85-year-olds, 85 years old and older. Then below that, it's in orange. It's the percentage of the total death that week from individuals who were aged between 75 and 84 years. Okay, so and so on. You understand? Okay, now that we know what each bar represent, or each column represent, what do you notice about this graph? What do you notice about the color pattern? So we have 32 weeks of data from week 1 ending February 1st to week 32 ending September 5th. So it's a little different time period than the time period I mentioned, and I gave you a number of deaths earlier for polls. And that's good because we have weeks pre-COVID-19, right? We didn't have COVID, we didn't have information on COVID-19 in February yet, right? So some of those weeks over here are pre-COVID-19. So anything striking about the pattern of those total deaths across age groups to you? Well, what's surprising to me is the blue chunks, right? So representing the death of older people. They're pretty much the same, right? The same length throughout. Same thing for the other age group, right? Which mean the percentage of older people who pass away every week as a percentage of total people who pass away. Doesn't change over the weeks shown here. And that's surprising to me because we've been told that COVID-19 was taking a toll specifically on older people, right? So I would have expected that percentage to go up during the weeks of peak COVID-19 death, which are weeks 11 through 13. And we don't have that. So that's surprising to me, right? That those, the size of those chunk of those columns in different color pretty much stays the same throughout the weeks. So that's one thing that's puzzling to me. What else is important about this graph and the numbers outlined here? What is worth emphasizing? Well, every week, individuals of all age groups pass away. All age groups. There are 530 individuals, 14 years and younger, passed away every week in the United States during that time period. An average of over 60,000 individuals died per week in the United States between that time, in that time period. So we can say that 50,000 to 70,000 deaths per week in the United States is normal. It is to be expected. And individuals in every age group pass away every week. I know we don't like to say it. We don't like to say that it's normal. But it is. And the good news is, every week, a much higher number of older individuals pass away than the number of younger individuals who pass away. And that is good news. Which age group are you in? Look for those age groups and figure out which one you are in, and then look at the death number per week and see how many individuals in your age group is pass away every week. And please, thank you, Tasha. Could you answer our next poll? Okay, so this is, again, this is important to put COVID-19 death in perspective and look at death numbers, total death numbers, and death numbers per age group. So thank you for your participation. So the category with the highest number of participants today is 3544. And we have 35, 34, that's pretty young, right? You guys are considering yourself pretty young. I'm not young anymore, but still 1,963 deaths per week over that time period. So 2,000 people aged 35 to 44 in the United States die every week. Early, happy every morning, and early too, but all right. Next to, so look at our next data set, we go to data.cdc.gov and we browse there. So we find our data set by, in the search window, typing weekly counts of death by state and select causes. And we find two data sets, a 2014-2018 one and a 2019-2020 one. I select each one at a time. When I select the 2019-2021, that's the page I end up at. There, I select the Export tab, under arrow number 1. And then I downloaded it in CSV for Excel format, and you might decide to choose a different format. So that's arrow number 2. And then when I do that, arrow number 3 shows this data set automatically gets downloaded on my PC. So that's how I did that. And then I merged both data sets. So we have data from 2014 to 2020. And this is the graph I made it in Excel with that. I plotted the weekly counts of death for the United States for the select causes listed in those data sets. And this is for the period from week ending January 11, 2014 to week ending September 26, 2020. The blue line is the plot of the total weekly deaths, so total weekly death for all causes. Okay, and then below that are all the different causes that were included in that data set. So if we look at the total weekly deaths, and consistent with the data we saw earlier, we can see we have around 45 to 80,000 deaths per week in the United States over that time period. Excuse me. We do see a spike of death in 2020, which corresponds to COVID-19 death peak. So far, so good. In that, it makes sense. The 2020 spike is higher than the 2018 one by 11,292 deaths. Okay, so what else do you see? So think about that. What else do you see on this graph? What else is noticeable to you, surprising? Okay, so what I see is death highs and lows seem to be seasonal. They're occurring at the same time intervals over the period shown here, right? So we see those seasonal highs and lows strikingly with our total death curve, but we actually see those for the causes, for deaths caused by all those different causes that has graphed below the blue line. So we don't see much for the yellowish line, which is malignant neoplasma, that's cancers. We still see those little spikes, for the disease of the heart. And if we look close, we see it for this reddish line below that, which is in the last stack of lines. And that's for chronic lower respiratory disease. And then for the dark blue one in that lower stack of line is for influenza and pneumonia. Okay, so we're going to zoom in on those next, but we see this seasonal highs and low. What else do we see? I plotted it on the blue line on the all death, all cause, a linear trend, because we do see a statistically significant upward sloping trend. So we have an average of 908 deaths increase per year according to that trend. So it's just a simple linear regression with the death counts, all deaths as your dependent variable, and the time actually, how many weeks did we say, or as your explanatory variable. So it's a time trend, right? So that's interesting too, because so this is a very simple data analysis, but if you if any of you would like to expand on that, you need to figure out potentially why do we have an upward trend in death. Maybe it's because our population is aging. Maybe it's because our population is increasing, right? The more people, the more death. Okay. So let's zoom in. So, well, actually, we're not going to zoom in yet. We are just, I guess, we have the same graph, exact same graph, right? We are looking at the 2018 peak. And if we look at this one, we already see it, right? This peak of total death in 2018 correspond to a peak of death due to disease of the heart, due to chronic lower respiratory disease, and due to increase in death due to influenza and pneumonia. Now let's zoom. Right, so here I zoomed in, and so you don't see the upper line anymore. Right, the blue line is the old death line is gone, and so we can see better the lines for each of the cause of death, right? And here you can really distinctively see that. So, and I left this, my pink rectangle there at the same time period that we had it on earlier, right? Because we're interested in looking at zooming in on that time period where we observed a peak in total death, right? And this peak in total death corresponds to a peak in disease of the heart and chronic lower respiratory disease and influenza and pneumonia. So the total death, we have an increased total death because death increased from many causes, influenza and pneumonia, chronic lower respiratory disease, and heart disease. We zoom in closer, so now we got rid of the line for heart attack and cancer. So we have only the lower lines, right? So what's interesting here, so when we zoom in on those lower lines, we actually see this a little bump, right? An increase for all the causes, right? So the total death increase corresponds to an increase in death due to all causes. This is important, right? When you observe, and this is important if you just take your eyes off that pink rectangle and look to the left and a little bit to the right, you can see this is true every year. So every year in the US, when we observe a peak, right, the seasonal ups and downs that we pointed out earlier, we have those. And each time we have those, we have an increase of death due to all causes, which makes sense, right? Now let's look at the 2021. So do we have the same thing? So what do you see over here? So I had taken the COVID-19 death line out just on the earlier slide so we could see better. So I put it back on over here because now we're looking at 2020 data. Okay, so what's going on? Those lines over here, to me, look weird. Pardon my French, but the 2020 lines are smooth, while all the others are lumpy. So something is going on here, I don't know what. If you have any ideas, please send me an email. I will give you my email address at the end of the presentation. What else do we notice though? It looks like, we'll zoom later, but right now, you can even see right now, it looks like the peak of COVID death is higher than the peak of heart attack. You see that? What's your reaction to that? Heart attacks are the leading cause of death in the United States, right? It's a green line below our all cause line, right? So it's the leading cause of death in the United States. Yet we see COVID numbers above heart attacks number from week ending April 11 to week ending May 2nd. What's going on? So we zoom in, right? We got rid of our blue line, our total death count. And so we want to see, look at all those causes. So I got rid of the COVID-19 line to see better what's going on, right? So first thing we see is when we compare the peak of heart attack numbers, so the death numbers due to heart attacks in 2020 to the number of deaths due to heart attack in 2018, right? So during our two period where we observed the peaks of total death, we see there was, during that peak, less heart attacks or deaths due to heart disease in 2020 than there were in 2018 by 367. Doesn't make sense. Doesn't make sense at all. It doesn't make sense because, like we said earlier, right? Every peak, total death peak, corresponds to peak in all causes of death, right? It makes, right? We have more death from all the different causes, and that brings up the total death number. So our death number increased in 2020, and we have less heart attack than in 2018. Where have all the heart attacks gone? Let's zoom in again. And what do we see for all the other causes beside the two main causes, which is heart attack, heart disease, and cancer? What do you see? I seem to see, and let me know if I'm looking at this wrong, I seem to see that within that peak rectangle, right? That peak rectangle, I kept them on the same time period where we observed those, where this total death peak. All the other peaks, right? For all the other peaks of total death, we observe the peaks of death from all causes. Here, and my eyesight is not what it used to be, I seem to see a decrease, not an increase, from all the other causes. Is that right? So 2017-18, corresponding to the spike of total death, we have corresponding spikes in all causes of death. In 2020, corresponding to our total death spike, we not only have a lower than expected increase in heart attack, but also a decrease in all other causes of death. How can that be? So here's the data we are looking at. This is data that was plotted. We're looking at week ending April 11 through week ending April 25th. And those are the 3 weeks where we had the highest number of COVID-19 deaths. For those 3 weeks, the records show COVID-19 death numbers to be higher than the heart attacks death numbers. So the last row over here in a purple pinkish. So that's a COVID minus heart disease. Those numbers are the number of death from COVID-19 above death from heart disease for each of those weeks. And so for week ending April 11, data show 486 more COVID deaths than heart disease death. For week ending April 18, data show 2,561 more COVID death than heart attack, heart disease death. And for week ending for April 25th, the data show 1,651 more deaths from COVID than heart disease. So the number above that in the blue cells are the change in the number of deaths for each cause over the previous week. So let's look at the middle column, week ending April 18, 2020. And then the first row is heart disease, right? And so we have minus 1,190. You all find that number? Okay, so what that number means is on our records, we have 1,190 less deaths due to heart disease that week compared to the previous week. Okay, so that's what all those numbers are. So if so stay within that column of week ending April 18th. If I add up all those negative numbers, I get the numbers before the last row, in the gray cells. I get the total decrease, right? The decrease in the number of deaths due to different causes that week compared to the previous week. Okay. So the data say we had a decrease of 2,540 deaths due to heart disease, cancer, chronic respiratory illness, Alzheimer, diabetes, flu and pneumonia, other respiratory condition, septicemia. So a total decrease from all those causes of 2,540. And compare that to a number of COVID-19 deaths reported above heart disease death number of 2,561. Don't shoot the messenger. I didn't make up those numbers. Please have a look at them and tell me what you think. So let's recap. We looked at numbers to put things in perspective and pointed out that from March 15, mid-March to mid-September, the US recorded 200,000 COVID deaths compared to a total number of 1.7 million deaths. By the CDC own account, in this pandemic, deaths of children have been less than in each of the last 5 flu seasons. We didn't mention that earlier, but I thought it was important to emphasize this here. We did look at all deaths per age group and found that there has been no change in the ratio of each age group death numbers over the total death numbers. So in other words, no change in the percentage each age group contributes to total death. And we looked at the numbers and know that 60,000 deaths per week in the US is normal. It's an equivalent to 3.1 million per year or 8,500 per day. Yeah, you heard that right. 8,500 per day. That's normal. So we look also at weekly deaths per cause of death and found that although heart disease are the leading cause of death in the United States, the number of deaths due to heart disease during the 2020 high of total deaths was reported to be less than the number of heart disease deaths during the high of total death in 2018. Also, for 3 of the 4 weeks where COVID-19 deaths were reported has been higher than heart disease death. So also for the 3 of the 4 weeks where COVID-19 deaths were reported has been higher than heart disease death. the number of deaths due to heart disease, influenza, and pneumonia, chronic lower respiratory disease, and more decreased compared to the previous week. All this points to no evidence that COVID-19 created any excess death. Total death numbers are not above normal death numbers. We found no evidence to the contrary. All this points to the reason we have a higher number of reported COVID-19 deaths among older individuals than younger individuals is simply because every day in the US, older individuals die in higher numbers than younger individuals. And that's a good thing. The data don't show older individuals are dying in higher proportion to total death than usual. We also found evidence that COVID-19 death numbers were misleading. We found evidence that some deaths caused by disease of the heart, chronic lower respiratory disease, flu and pneumonia, and more were simply reclassified as COVID-19 death. Before we open to for questions, I'd like to run a last poll. What do you think the US life expectancy is in 2020? Well, you guys are doing good. You are getting the right answer again. So the majority of 56% of respondents have chosen 70 to 79 years. And it was according to the, I think I looked at the, I don't remember if I looked at CDC or another webpage, but 78.7 is the one that I saw, with it being 40 to 49 years in 1860, all the way to 1900. So family and friends mourn the passing of their loved ones, no matter their age at the time of their passing. And the passing of a loved one can be for some devastating. Nonetheless, as a society, the passing of older individuals should not be something we should dread or fear, but instead celebrate. Long lives lived are something to be grateful for and worth celebrating. I think that's something we should not forget. So what's next? I guess the academic answer will be more study is needed, more research is needed, which it is. So do fact checks what I presented, try to replicate and expand data analysis. I hope I hear back from people who have done a lot more than me as far as looking at those data. You know, there's those are time series type data, and some of our students in our program might be inspired to use their cognitive skill to look at this. We mentioned that the trend of total death was upper sloping, and so additional variable that would be needed to look at would be population size and age to see if that increase is due to one or the other. And there are probably other variables that I haven't thought about and I'm not thinking about right now that you guys can think about. It seems like we need to do have a bottom-up approach to evidence seeking. We looked at the national data level over here, but others can and probably have. I just don't know. At state data or county data, even township or hospital level, to answer a question like, did we experience a pandemic? Are we still experiencing one? At the local level, the answer cannot be, yes, don't you know? It's a global pandemic. It seems that we have to seek the answers to these questions at the local level. Are we experiencing more death than usual? What is happening to death numbers across causes? Are different age groups dying in different proportion than usual? So everyone everywhere in the world at every geographical level should do the same, look at their own data and see what they are telling them, instead of relying on a faraway person telling them what's happening at their local level. Maybe it's time to take our shoulders down and step outside and see for ourselves. The zombies might be gone. So I guess we have a few minutes for questions. Thank you for being here and listening.
Wonderful. Thank you so much for that presentation. I think you gave us a lot to think about. And according to the Q&As, we have quite a few questions that have come in. If you have any questions and you're thinking about them right now, feel free to pop them in the Q&A. And you're also welcome to read through other people's questions and upvote them up. That way, with our limited amount of time that we have today, we can address the ones that everyone thinks are the most important. And so the first question that I'm going to read for you, it came in pretty early in the presentation. It says, are the CDC numbers from COVID deaths during the period an estimation, or are they based only on deaths that have been associated with the COVID-19 diagnosis?
So the COVID-19 deaths are, they are
an estimate
estimate
or diagnosed?
They're not estimate. They are the data that they receive from the states, and I don't know if I mentioned that yet. In the bar graph we showed, when you go, if you download those data, they say the last 5 weeks are not complete. They're only 90% complete. So actually, I had taken off those 5 weeks before I drew the graph. So they are not estimate. They are real data, but I guess it takes time to gather them up. So they would be readjusted as time goes by.
Okay. Good to know. Thank you. The next question that we have is a question really for me. It's asking if this recording will be made available. Yes, we are recording the presentation, and then I will be sending it out to everyone who registered, as well as putting it public on YouTube. So you guys can go back and reference it and go through it and kind of work through that data and rewatch the presentation. The next question says, there are many confounding factors. I don't know if doctors would agree that they have misclassified deaths as COVID when patients have actually died of heart disease, cancer, etc. Not really a question, but what are your thoughts on that?
Well, I mean, all those results were surprising to me. They are somewhat misleading, and some of them are going to be misleading in that because the data show the number of heart attack decreased during that peak of total death that we experienced, and this heart attack is the leading cause of death in the United States. So we should have, if they were not misleading at all, what we should have observed is increased number of heart attack, and then also COVID numbers, right? But decreased number in heart attack and all the other death causes, as we saw, doesn't give us a choice but to point to some reclassification, not all of them, but some reclassification of the death. And it makes sense because we are just concentrating on COVID-19. We are just looking at COVID-19. I am not. I cannot speak for healthcare workers, but the data tell us that the diagnosis were. The question was, when you receive patient in cases, was COVID-19 as opposed to what else could it be? The data that I use, I don't know if it's referring to the question earlier, as everybody heard about the fact that only 6% of the COVID-19 deaths have no other underlying condition. and the data that I looked at is consistent with that. And the graph that I drew of the COVID-19, those account for all COVID-19. So whether COVID-19 was on the death certificate reported as the main cause or not, or underlying. Okay.
Great.
I hope that answers some of the question.
Great. The next question that we have, and I think you kind of referenced this a little bit earlier too, talking about how it takes time to really finalize that data. It says, isn't a lot of the data from 2020 still preliminary? She says that she's on the CDC website and finalized data isn't enough or hasn't even been available for 2019 yet.
Yeah, that's I know, because so when so in the specific reference that I gave you, the specific and I don't know, a website where I looked at those data, so the graph up of the death up and then of COVID-19 deaths that we're all familiar with up and then another peak a little lower than that. It does specify, so again, the last 5 weeks are not complete. The first one I had looked at way back was another source of data in the CDC, and where they list actually is also, because all those here that we looked at are natural cause. And there's also suicide and accident, and those are added to cause of death. And the report and the PDF file that I had seen when I was looking at those numbers that include natural deaths, but all the causes that we looked at today, and those unnatural deaths like suicide and accident. I had found only, yes, I think it was actually only 2015, but those were the latest PDF that was posted on the page that I've seen. But they were they combined different data sets, since they were, and maybe from different agencies, because they were looking at the non-natural cause of death too. Yeah. So yeah. So I don't know. So yes, please do check on whether or not it doesn't from the data that I downloaded. Like we were stating earlier, it's stated the last 5 weeks might not are only 90% complete. So I had deleted them from that graph, and so yes, it's probably changing. But now, the peak of the COVID-19 death and where we observe this weird-looking thing, and where we observe this worrisome-looking thing, where some of the COVID-19 death might simply be overcounting other type of death. Those date back from the peak, so that March. So they are, what did you say, April, right? April 14 and whatever weeks I had on my on that table. So those should be so those are from April, week ending April 11 to week ending April 25th. So those should be they should have the last data on that. I mean, the definite data on that.
Okay, great, thank you. The next comment, and just again, we're limited on time, so if you want to upvote the questions that you are most interested in hearing about, please do so, because we won't be able to address all of the questions today. The next one that I have has been upvoted twice. It's actually one of our more recent questions. They ask, how are we supposed to look at the data? Should we consider that those who died from other diseases that were accelerated by COVID? If so, then maybe all of the disease and other disease deaths as indeed balanced by the COVID deaths, since younger, healthier individuals with no prior conditions have a much lower death rate from COVID.
Could you repeat that, please?
Yes. How should we look at COVID deaths then? Should we consider those who died from other diseases that are affected or accelerated by COVID? If so, then maybe all of the disease and other disease deaths is indeed balanced by the COVID deaths, and since younger, healthier individuals with no prior conditions have a much lower death rate from COVID. So the question is, how should we think about it since the other diseases might be affecting COVID, or COVID's affecting the other diseases?
Yeah, the thing is, I mean, I guess I don't have the answer to that question. The only thing I take out of this is that it is not as, and it's important, it is not as dramatic as we are led to believe, because because we right now it's hard to discern if the increase is right. The question is, right now it's hard to discern whether or not the increase in death, right? We're interested in total death, right? Whether it comes COVID-19 or whether it COVID-19 that helped increase total death, really doesn't matter. I mean, in the end, it's total death. That's why we cannot just look at just COVID-19. Do we have an excess death? Do we have a lot more death than normal? Like in 1918, I think you look around you came back from a trip on came down your boat, you know, to 30% of your people that boarded the boat were dead. You know, so do we have that today? Have you lost 1/3 of your colleague, your neighbors? The data doesn't tell us that. Why we right now, so we have a peak, yeah, but it's not that much higher than 2018. And so how much more death were we expecting, given that the trend is up, right? And then so yeah, the question is, what's the real burden, the total death burden? Every life, right? Every life is important. So it's not because you die of COVID-19 you're more important than if you died, if you die of an accident, or if you commit suicide, which right. And so we not only we need to look at the whether or not we had we just trade off death one for the other, right? In our total death number, or if we had an increase in total death number. But then in the policy that we adopt related to that, you know, in our lockdown and everything, we need to look at did we cause additional deaths, like the suicides?
Right. Thank you. And one of the questions I'm going to try to get to, at least two more, it's kind of related to what you're talking about. It says, total trend line of death is in the rise. That's the question. Does that correspond to the overall growth of population, which I know you talked about a little bit?
Yeah. We probably, I don't know if it's yes, probably, because well, I don't know actually, because I looked only at well, you could figure that out if you look potentially at those percentage that each age group contribute to total death over that longer time period, right? The one we looked at was a very short time period. And if you look at that at a longer time period, then you can figure out whether, if your population is older, then you'll have a higher percentage in those higher number of deaths, and the end, you'll have a higher percentage among the older population, right? So we don't, I don't know, without looking for closer, whether it's due to the increased population or to the increase of the aging of the population, and or to, I don't know what else. I mean, that could be other factor that we haven't thought about. Yeah. That I haven't thought about.
Yeah, I think there's a lot more to dive into for sure. As you said, what are the next steps? More research, more analysis. The next question that I have is, can the total death peaks be compared if they occur at different seasons? It looks like the cause of death spiked towards the end of the year prior to 2020, but since COVID-19 became around April, wouldn't it have skewed the seasonal cycle we typically observe in individual causes of death related to the total deaths?
Good question. I don't know. Actually, you know, if did we, so if you ask the receptionist when you go visit the hospital, or the lady who takes care of the elderly in nursing home, she might have answers to that. I don't know if we accelerated that, like in New York when they put COVID-19 patient in their elderly homes, right? I don't know if we slow down the deaths because we did not allow any visit to our elderly. So I don't know if, you know, if the peak of death usually occur because it's I don't know, it's a winter, and with the visit, some of the elderly get a flu or a cold. I don't know that. That's a good question. Did we just shift the date because of the COVID-19, because of the policy we adopted? I don't know. But older individuals, that's what they do. They have to die. I mean, in the end. So, and did we just bury those elderly alive? That's another question, right? As well, and because it's important to think about the numbers of deaths and also the consequence of our policy that we have adopted related to this. It's a good question. It's just like related to econ when we had the Clunker Cash for Clunker program, where we gave money for people to buy new cars, so that the sales of cars increased, but then it went back down because you buy only so many cars per year. So did we shift the deaths with our policy? I don't know.
Yeah. If you don't mind, I see a lot of engagement happening. We still have 22 questions. We obviously won't be able to get to all of them. It looks like some of the top comments that are being put in here are, it's kind of like, what happened first? Did COVID increase the deaths because of people who already had diseases, or are the diseases the opposite? So one of the comments says COVID killed some of the people before their disease could. But then the opposite of that is, so people could have died from other disease are now dying from COVID.
Yeah, I don't know the answer to that either, but it's a great question. And the thing is, since we, but that begs the question of how, so again, whatever you're going to die from, heart attack or COVID, or whether COVID this year speed up your death, and that happens every year. Right? Every year people are sensitive to cold and flu, and they get complication from that. They get pneumonia, and then they pass away. And I'm not a doctor. It's just a common knowledge. Now I can't remember what I wanted to say. So. Could you repeat the question, please?
Yes. Let me dig it out real quick. COVID killed some of the people before heart disease could. So people, and then this is a separate comment too. So people that could have died from other causes are now dying from COVID. Are they dying from COVID even though they probably would have died from a different disease?
Yeah, we don't know the answer to that. Yeah.
Here's another question I think will be a little bit easier to answer. I think you brought it up a couple of times. It says, are you saying that COVID death counts might be misleading or overstated?
What's the difference with that? Overstated or misleading? That's what I meant by misleading. That's what I meant by misleading. I guess it's overstated. Yeah.
So yes, yeah.
But I'm and this is just right looking at the data, right? And those numbers were surprising to me, as they are surprising to everybody else. Okay, so what I wanted to say is, it doesn't matter whether you die. Okay, so we don't know if it's COVID first or the condition. The question is, how are we going to best address it, right? So I'm, let's say I have a heart condition, I'm over 50, and so what's the best way for me to prevent my death from COVID-19 or from heart attack? So is it to isolate myself, or is it to exercise? Right. So when I see the poster of the CDC that has physically inactive people sitting on the bench, and then they self-distance, and they say self-distance instead of self-distances, should you do exercise? Is that going to be a better way and actually engage and interact? Because the morale also affects your health, right? If you're depressed, your immune system goes down, and you're more, right? We all know that too. So the question is, what's the best way to fight it? Is it to isolate yourself, or is it actually to be happy and meet people and exercise and get out and exercise and live?
Yeah. Okay, well, I am seeing tons of questions still in there. A lot of people just hypothesizing to kind of explain the data and draw more conclusions, although kind of like you pointed out, it's really hard to do that without digging deeper and deeper into the data. I just want to thank you all for attending today and for joining us for this presentation. And again, of course, Genevieve, thank you so much for taking your time, pulling out all this data, showing us how to do it so we can continue the search on our own, and posing a lot of those questions that we've been asking today. You all are welcome to reach out to Dr. Briand if you want to. Her email address is on the screen. You can reach out to her and continue the conversation offline. Thank you all for joining, and we will see you at the next event.
Thanks, Tasha.